All right, guys. Well, thank you for joining in. And the number one reason people go to the chiropractor, we're going to tell you here in a minute, but let me introduce myself. I'm Dr. Amador from Dulce Vita Chiropractic. I'm a chiropractor, and this is.
Hi, I'm Dr. Garza. I've been practicing for over 30 years, and we're here to help. Basically, that's what we want to tell you. And, we're here to help you keep your life together, make it work, do what you have to do, and do what you want to do.
There you go. So, the number one reason why people come and visit the chiropractor is, let's see it, drum roll. And it already fell there. Oh, it's because of pain. All right. So pain is the number one reason why people go visit the chiropractor, but don't go yet, because there are several types of pain, and the most common one is, I carry something heavy, I hurt my back, where do I go? But there are several types of pain, right?
Yeah,
Dr.
because
G?
that's what's going on. You end up having the pain, but there's different indications of what's going on. And that's what we're here for, to figure that one out and also help you with the back pain, okay, on your spine, the headaches, the neck pain, the TMJ, which is your jaws, joint pain, any of the other joints, shoulder, arms, knees, legs. So we can find the problem so we can start fixing it.
Yeah, so there are several things that we do help with. It's not just back pain. It's all these other things that Dr. G mentioned, and they're here on our favorite list. But let's move on.
Going on.
So, with back pain, some of the possible reasons that you could have pain could be poor posture, right? Too much, spending too much sitting. Sitting is the new smoking, right? You could have gone to the gym, and it could be a sprain and strain. What other thing would you say that we could have?
Well, when the bone gets out of alignment, especially in the spine, it's going to put a lot of pressure on the disc.
Hmm.
So then that's going to also cause more irritation in the nervous system.
Yeah, and so we would have things like a herniated disc, right? And this is what a herniated disc looks like. I don't know if it's catching it when it's
Yeah.
popping out,
Uh-huh.
but basically you went into compression and then you went to flexion and then boom, pops out. It kind of touches the nerve root, and that's what causes all that pain. So that's what we call a herniated disc. We can also get nerve entrapment, in the muscle tissue and anywhere in the body. Can be through muscles, ligaments, tendons. It can
Tendons,
get
yeah.
it can get trapped
Mhm.
there. Spondylolisthesis is another
Yeah.
common one.
When you have one bone on top of the other and then the bone slips on top of each other.
Slips forward.
Yeah, and then that's where it irritates the nerve. And
Yeah,
that's where
so
it
it's
starts
kind of
hurting.
choking it. It's kind of
Mhm.
choking the spinal cord over here when it moves forward. So it's kind of like a smaller form of dislocation
Mhm.
type deal. And then we have a spondylosis. Spondylosis is just basically inflammation, right?
Yeah.
Degeneration of the joints. So you could see that a little bit with, arthritis is inflammation.
Yeah.
And then
And
there's
now that you're getting
other
into that, the
diseases.
degeneration
Yeah.
is that once it's out of alignment, then the body starts wearing out a lot faster.
Yes.
And that's what we want to avoid. We want to avoid arthritis, that type of problems that later on in life we're all going to have. So, but you can avoid it.
And we'll do more separate videos on those topics. And then also spondylosis. Spondylosis is just a simple fracture due to trauma usually. Okay, so let's move on. So headaches. What can you tell us
Yeah,
about
the,
how
the
we can
problem
help
the problem with the headaches is it starts with the nerves here in the back of the head. Now you can have headaches in the front, on the side, on the top, or in the back. All right.
headaches? You can have headaches.
All kinds of headaches. And then it also can affect your balance, it can affect your hearing, it can affect your eyes, it can affect your jaw. Okay.
Yeah, so it can be because of bad posture. You have the
Mhm.
the tech neck
Yeah,
type deal
got it.
scenario.
Mhm.
You have sprains and strains from the neck that
Mhm.
affect also the headaches. Herniated disc, that's also in the neck, and we'll move on to the neck here in a minute. And then the nerve entrapments and high and low blood pressure, right?
Then that
Because
triggers that also.
that
Yeah.
that can be triggered by that.
Mhm.
So you're gonna have migraines. That usually is the symptoms where it affects your vision, and you have severe headaches. You have the tension headaches that you
Yeah,
described that are around the whole
on top of the head,
skull. And then you have the cluster headaches that
Mhm.
usually just on the back or
Back
in
of
the
the head.
front.
Yeah.
So we can help with those. Of course, we'll need to do some testing as well if things don't improve uh, after checking the neck, right?
Mhm.
Because the neck is a very important component and that
Yeah, because
affects the brain.
you have the brain inside the head, and then you have the spinal cord coming out of the back of the head,
Mhm.
going down through the spine. So that's what we're looking at. If you have any irritation on any of those nerves, it's going to cause those symptoms.
Yeah, and you can have all these symptoms as well. So you would also watch for any traumas on the neck as well,
Mhm.
especially if you've been in a car accident and you
Oh,
did the
forget it.
whole
Yeah.
whiplash.
Mhm.
Somebody hits you from the back,
Yeah.
you roll forward, and then the airbag hits you, and then you go back.
Yeah.
So like a whip.
And those are the ones that go along with the motion of the body. But when you get hit on the side, then that tears up a lot more fibers, a lot more tissue. So that's why we need to look at the mechanism of the injury, and then that way we're able to help you a lot better.
Also, diseases such as arthritis also can attack the
Mhm.
neck, and attack anywhere in the joints, and
Mhm.
then torticollis, right? When
Yeah.
kids are born, usually
Mhm.
they're having problems getting out of mom,
Yeah.
and sometimes the doctors may use
The,
aggressive
the
maneuvers,
forceps and all that. Yeah.
forceps to pull them out, and
Mhm.
then that usually is the thing that causes torticollis.
Yeah.
And then, so yeah, we can help with that, definitely. Another thing that we can help with is the TMJ. The TMJ, it can be confused with infection of a molar, right?
Yeah. Mhm.
Of a tooth. But I mean, usually people know what it is, but if it's too close to the back and it's just the beginning of it, it can be confused with it. But TMJ is going to be here affecting your trigeminal
Yeah.
nerve.
And also another thing that happens is your jaw starts popping, because if it's out of alignment, and then when you move it, normally it has to have that normal motion to it.
Yeah,
But then if it's out of alignment, then it's going to start popping,
yeah,
and then it starts wearing out a lot faster. And
yeah.
so that's one of the things we're trying to avoid is arthritis of any type. And then that's why I wanted for it to track correctly, and that goes with the whole body. You know.
And so the joint, I know it moves
Mhm.
forward and down,
Mhm.
and then it comes back up.
Yeah.
And then, so whenever you're eating like one of those jawbreaker candies, there could be a sprain and strain also as well. So it could be a little bit of the muscle issue. Could be, like you said,
Yeah.
it's gonna move a little
Mhm.
bit, and like a disc damage. There is a little disc
Mhm.
in
Mhm.
that joint,
In the joint. Yeah.
in the temporomandibular joint. It's a little disc that actually gets a little bit out of place and gets pinched,
Mhm.
and then that's what kind of makes it the clunk
Yeah, makes it
because
pop and all that. Yeah.
it's not correctly set. So we can help with that, and of course, poor posture also because the muscles of the
Mhm.
neck
Mhm.
they they
Yeah.
can mess also with your muscles affecting the TMJ.
Yeah.
All right, so let's move on, and then the next thing is joint pain in general. This is just going to cover a lot of different things, just to kind of wrap things up. Sprains and strains, disc damage, nerve entrapment, pain caused by accidents and trauma.
Mhm.
That can be fractures. Poor posture is, one of the daily things, right? That can
That
get us
happens
in
every
trouble.
day. I mean, and it can affect your shoulders, your elbows, your wrists, your hands, your hips, your knees, your ankles, your feet. So they get out of alignment, and as you're trying to track it, you're trying to move it, you're trying to use it. That's where it starts hurting. That's where it starts bothering you. You can have some like popping noises, which is crepitus, and that's why it's one of the things that we need to do is recalibrate all this. Put it in its place. For it to stay in its place, we need to recalibrate the body.
Yeah.
And that's why we're always recommending for you to, do your exercises and take care of yourself.
And of course, it can be, other things such as diseases and infections, and that's what we're going to talk about at the end.
Yeah.
So, as chiropractors, our job is not just to, hey, it hurts
Mhm.
here,
Mhm.
that I'm going to manipulate that
Yeah.
shoulder. oh, it hurts the back, I'm gonna manipulate the back.
Yeah.
We do take an analysis, right? We do make our differential
Mhm.
analysis to find out if it's actually, what you think it is. Usually the patients know themselves fairly well,
Mhm.
and then so we're just trying to verify, what could be and how we can help them.
Yeah.
So not every pain in the back is from back pain or
Yeah.
neck pain or.
Mhm, mhm.
So let's say we just picked a couple of ones. So kidney pain can radiate
Yeah.
on the back, and it can
Mhm.
feel like you're having a back pain. So there's an infamous kidney punch test that we can
Mhm.
do, right?
Yeah.
And some other orthopedic tests to just kind of help it separate of whether it's probably the kidneys or the back pain. We don't do anything to the kidneys as chiropractors, but
Mhm.
so that we can refer you out to the proper
Yeah. The proper
doctor.
treatment. Yeah.
The same thing with the gallbladder. If you're having pain in the I'm gonna lower it here.
Frontal abdominal.
Yeah,
Yeah.
in the right upper quadrant over here.
Mhm.
Usually that's where the pain is indicated, and it can travel back. So it can
Mhm.
go from the front, it can go to the back,
Mhm.
and people feel it all over the place
Yeah.
on the back by
Mhm.
the thoracic lumbar junction in
Yes.
that area. And then the appendix, sometimes getting like that. Oh, it's probably the hip. It's
Mhm,
not the
mhm.
hip.
Yeah.
And when you go press there on the appendix, on the right lower quadrant,
Mhm.
then you can quickly realize, oops, it's not really your hip.
Yeah.
Fibromyalgia, just kind
Mhm.
of like this pain that's kind of overwhelming all over the body.
On the joints, on the
That's
muscles. Yeah.
that's more systemic, and
Mhm.
and medical doctors are still trying to figure it out.
Mhm.
Uh, we believe that it's mainly because of inflammation,
Yeah.
sugar,
Mhm, mhm.
those type of deals.
Yeah.
Um, and then anything else that you would like to add on
Yeah, well,
diseases or
yeah,
infections?
it goes into all of that, and that's why we also talk about nutrition and that kind of things that are going to help you to get as healthy as possible.
Yeah,
And then another thing you were mentioning there is infections. Because sometimes you have a low grade infection that is bothering you, it's giving you all these symptoms, and we need to be able to find something like that and start helping your body to heal itself.
yeah.
Yeah.
So either way, come see me, Dr. Amador at Bolsa Vida Chiropractic, or
Mhm.
go see Dr. Garza,
Yeah,
wherever he may be. And, you
wherever.
you can contact me, and I can let you know where
Yeah.
he's at, and we'll leave my information somewhere around here. We're both in
Mhm.
the Garland,
Area.
Texas area,
Mhm.
Mesquite, Rowlett, Rockwall. You know, basically
East
everything east
Dallas.
of Dallas.
Got
Okay.
it. All right.
So thank you guys, and I hope you
Uh-huh.
enjoy the video. And don't forget, we're here to help you. Thanks.
All right. Have a safe one.